The focus on the health insurance. Good evening. My name is Gloria Kalambo, and welcome to Crossfire. Director General of the National Health Insurance Management Authority, that happens to be NHIMA, Mr. James Kapesa, and President of the Judiciary and the Allied Workers Union of Zambia, JUAZ, Mr. Peter Mwale. Gentlemen, welcome to Crossfire, and of course, good evening.
Thank you and good evening.
Thank you so much.
Thank you so much for coming through. Of course, we're discussing a very important aspect of the health sector tonight, that happens to be health insurance. So we'll focus particularly on that particular aspect of the health system. We'll start with you, Mr. Kapesa. NHIMA, for the sake of our viewers, really, help us understand what led to the formation of NHIMA.
Gloria, thank you so much. And once more, it's a privilege to have this chance and platform to share the genesis of NHIMA with the public, but also to update the public on the strides that NHIMA has so far scored, but also to share with the public some of the areas where we continue to require public support and also public encouragement. The creation of NHIMA didn't happen in 2018 when President Lungu signed the bill into law, April 2018. It had started way, way back. And it came and was born out of an idea that every Zambian, when they are born to the time that they go to the grave, must have some form of health cover. By that time, most of the health covers only covered you because you worked for a particular employer. And so when you left employment, you were left to your own whims and chance. Government was of the view that this is not how it needed to look after the health of its citizens. So the National Health Insurance Scheme was therefore crafted to provide what is called universal health coverage, meaning all Zambians from birth to death and established residents, pooling their small resources into a basket called a fund, and using this fund through the National Health Insurance Authority to go and purchase high-quality health care. Now, Gloria, this high-quality health care then allows the people that have put their funds together to reduce what is called catastrophic health expenditure at the point when our people seek health. What do I mean? By the time the scheme was coined, only 4% of Zambians, 4%, Gloria, had access to one form of health insurance or the other. And so the other 96% had to fork money out of their pockets to pay for health insurance. This became a barrier. So people stayed home, scared to go to a hospital because they had no funds. Those who had assets sold their assets. Many of our people, even those that are working, had to start getting into Kaloba so that they can pay for their health bills. Others had to sell their assets. Government said, no, 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 no. For us to stimulate growth, for us to reach Vision 2030, we need to make sure that our people are healthy and they are wealthy. Now, before I move on, this was also then needed that we went and consulted partners. So unions also came on board. And during the government reforms, they had 7 pillars of government reforms. One of them was microfinance for government. One of them was the funeral scheme, and the health insurance authority and scheme was one of them. So this is also a product of a lot of consultation with unions as part of the negotiations for those that are in government employment.
Just quickly, before we move on and before we get to Mr. Mwale, I'd love to find out, so how does the scheme work? In a very short explanation, how does the scheme work?
So every Zambian between the age of 18 to 65 contributes 1% of their income. If they are in informal employment, 1% of their assessed monthly income. This money comes to a big pot called the fund. Then my team goes to all the hospitals and negotiates that when you go to the hospital, you don't have to pay anything. The hospital will send a bill to me and I will pay that bill on your behalf. So you don't have to be worried about paying 20,000 for a cesarean section. You don't have to be worried about paying 1,500 for X-ray. That 1% you are contributing, Gloria, I am purchasing healthcare services for you across right now 141 hospitals and pharmacies and laboratories. That's how it works.
All right. Now, Mr. Mwale, there was some resistance from unions in the introduction of the health scheme. Yes. But the health scheme is here now. Have your members received it? The past 2 or 3 years that it's been operational?
First of all, thank you so much, Gloria, that I'm here today to discuss this very important aspect of health care provision in Zambia. Briefly, let me just give you a background of what transpired. Actually, it is us, the unions, who started this idea in 2012 in Siavonga. And we demanded for 2 things, a funeral insurance and health. So government, it was a process which came as a result of a bargaining process. Okay. So when we started agitating for improved healthcare provision in Zambia, we had seen this concept being done in other countries. Me, I'm one of those actually who went outside Zambia to go and see how other jurisdictions have done this healthcare system. Now, when we came into Zambia here, it started from the bargaining process. Various unions, when we went to bargain for improved conditions of service of our members, one of the issues that came was that we needed proper health care provision and also the funeral processes. So we started the process, and in one way or the other, of course, we engaged government through PSMD and so forth. Now, along the way, the process of health insurance and the funeral insurance, we could not agree with government. You remember us through ZCTU, we took a certain position because we had highlighted what we needed to see in this health insurance scheme. So what happened, we started the negotiations with government, and along the way, government abandoned the process, went to parliament, enacted a law, and believe you me, I think you remember, Gloria, that us unions, we didn't support the formation of NHIMA. Let me be on the record very clearly, we didn't support it because we saw that the way the implementation, the program...
That was before it was formed.
Yes, when we started the negotiations, we needed an insurance scheme, health for that matter. Funeral, we are doing it with Madison. I think the director can agree with me. Even if the same one for insurance, for funeral, is pathetic, it's not doing well actually. So now when it came to this, sometime in September 2019, an SI was signed. Okay, an SI was signed. I think it's statutory instrument number 63, if I'm not mistaken. 63. Yes, it was signed, which now made it into law. It provided the rules and the regulations and the membership because it became law. So everyone now became, and us through ZCTU, we went to parliament and submitted to the contrary. Because, first of all, we looked at who should see this scheme. Is it Minister of Health or Minister of Labour? That argument was very hot, I think you remember. And apart from that, the way it was done and couched, we didn't agree. But of course, government went to parliament and passed the law. So now, when it became a law, it meant that it's mandatory. Again, thereafter, our cry was that, look, I heard the director here is talking about the universal health provision, which is okay. But now, what became a challenge now was when it comes to contributions. Government, through this NHIMA, went ahead and effected a deduction, I think in October 2019, if I'm not mistaken, or January, somewhere there. They started deducting from us. Now, the principle of an insurance, from what we know from the research that we've done, is that today I pay an insurance, tomorrow I should begin to access the services. But I think that the director can agree with me that even after public servants, because it is easier for us as civil servants to contribute, and they went quickly and we started contributing. Sometime in October 2019, and they said after 4 months, we'll start seeing the benefits. But I can assure you, Gloria, as I speak today, this NHIMA thing, we've been contributing, I think, for the past 2 years now, and we believe now that the director, where he's seated there, you have accumulated a lot of money from our members. But I can assure you, very few people are getting a benefit from that money. That I can guarantee you. And I'm able to play the messages. When you told me I was coming here, I sent, we have a platform as judicial workers.
But before we get, I'd love the director to just help us understand how the insurance scheme is faring so far. There's been a lot of talk on social media platforms and other sections of the media as well as to some of the challenges that the scheme is facing. Have people begun to get the benefits of contributing?
Yes, and Gloria, first of all, we would like to place on record our the value that we have, and also the importance of partners like Mr. Mwale and the union leadership. They are a key stakeholder, and we continue to receive feedback open-heartedly, so that this process, which, as he says, was started by the labor movement, continues to improve on a daily basis. And so when Mr. Mwale and the labor movement provide feedback to the authority, we take this feedback very seriously. This feedback comes into the authority, into NHIMA. It's processed through our systems and becomes work for us, work in progress for us, so that the next time
as any other system.
Exactly, so that the next time you invite me with Mr. Mwale, some of the things he will talk about, and rightly so, I'll be able to say, Comrade Mwale, this is the issue raised. I think, look at what we have done. That is how institutions are designed. There's no point where you have to wait for perfection for an institution to start. Now, back to your question. In October 2019, we started pooling these resources into a fund. On 1st of February, we opened the scheme to all members who had started contributing. And so, as I sit with you now, we've just done about 1 year of about 100,000 members who have gone to hospitals. And when they go to the hospitals, they are able to be identified as contributors and are able to access a predetermined benefit package. Now, Comrade Mwale has said some of his members, or most of his members, are yet to benefit from the scheme. And I would agree with him in this way, that again, the essence of a health scheme is to keep you well with a peace of mind. That should Comrade Mwale be away on national duty, union duty, and Madam Mwale at midnight is indisposed and wants to go to a hospital, he doesn't have to trouble his mind that he needs to look for money at midnight. That my Mulamu, Mrs. Mwale, can go to any of our hospitals, and using the contributions that Comrade Mwale has been making, she will be attended to without having to pay. So, Comrade Mwale, some of our members who are yet to visit hospitals may not directly go and get medical treatment, but we give them a peace of mind, because that's what insurance is. Insurance is to say, when your vehicle, for example, Gloria, you are driving to Chipata, in your mind you know that should the unforeseen happen, I don't have to go and to start borrowing money to repair my vehicle. So we are telling our comrades in the unions that the scheme may not have allowed you to go to a hospital because you are well, but it gives you assurance that you will not need to fork out. The benefits, Gloria, have been coming in. We have testimonies of teachers, testimonies of police officers, testimonies of farmers who have gone to hospitals and where they should have paid 80,000 kwacha for a cath lab operation to put pacemakers in the heart. 80,000. The scheme has paid for them. Where they needed to have a cesarean section for 15,000 kwacha, the scheme has paid for them. Our prayer is that as the scheme grows, Comrade Mwale and his team will also be part, and some of them could be part of the benefits that we are providing to our people through the scheme.
Director, one of the questions, or one of the issues that have also been raised by some members of the public is that there was already some sort of existing other forms of schemes that some, mostly civil servants, were actually contributing towards. Wasn't then the idea maybe to work with the ones that were already existing as opposed to having another one? So others actually are contributing to more than one health scheme, and they're really having a challenge as in terms of benefits, as Mr. Mwale has already outlined, and the like.
The existing medical schemes, Gloria, were what we call voluntary schemes. So they would be formed by, for example, Comrade Mwale's union, and they would be pulling into a scheme. Those schemes were run by private individuals working with unions. The law is that those schemes can continue. NHIMA doesn't come to upend them. Those schemes can continue. But in all countries where you have seen tangible development and creation of wealth for people, there is a national scheme that covers every individual. In this particular case, from the moment you turn 18 to 65, you start making this contribution. Comrade Mwale spoke of the 4 months. Gloria, the 4 months is a feature of all insurance schemes. It allows us to create reserves, but also, should Comrade Mwale, heaven forbid, see or demise, his family has 4 months. That 4 months, he has 4 months to continue enjoying the scheme before we change into a different category. It's also important that the scheme also collects money from informal sector. So it's not only those that are informal sector.
I have a question at a particular point.
Now let me make a very important point. So once Comrade Mwale and team reach 65, they stop paying to the scheme. And so if my Mbuya lives for another 10, 20, 30 years, so you see that the money that, so he may not have used the money whilst he's young and healthy. And so it's not correct to say he has not benefited, because he's creating a bank when he's 65, up to the time the Lord moves him away from this world. He has created a bank which he can now go to and use. So that's how the scheme became national and still allows other schemes which are private to continue operating.
All right. Now, Mr. Mwale, of course, you mentioned some of the issues that you had in the formation of NHIMA. NHIMA is here, like I said even before, but what are some of the challenges that you would pinpoint that director here would take into consideration?
Yeah,
that
in fact, there are a lot of them.
Your members are actually facing when it comes to accessing proper universal health coverage. Can
you allow me to?
I wouldn't want to get into the...
Yeah, anyway, what is there is that since the NHIMA started, I think my appeal to the director here is that you have a lot to do, because right now the National Health Insurance Scheme that we public servants, first of all, I think you agree with me, Director, if today you tell us that you are also collecting money from the informal sector, there is very difficult. I don't think that you are collecting as much money as you are collecting from the informal sector as compared to the formal sector, particularly the public service. That is why when the scheme started, the first target people were targeted to contribute this money were civil servants, for one simple reason, because it is easy for us, we are organized. It is easy for us to go to PEMIC, Minister of Finance, deduct, and so forth. Then you private people maybe came later on and so forth. But this is a law. It mandates everyone now to contribute. Now, the challenges that we have, Us ourselves wanted, first of all, to see the improvement of these public hospitals. Today, right now, I can tell you, I've got members myself who are in Munirunga. I have members who are in Zambezi, members who are in Chadiza, members who are in Kaputa. There, I think the director can agree with me. Ministry of Health and our health services in Zambia are very poor, director. That one you have to admit. Now that we are paying, you are getting money from our salaries, we expect to get the best medical facilities. Let's not even go very far. Even at UTH, even right now if you go to UTH, you find that many often the X-ray machine is not working. There are no medicines in these hospitals, director, and yet we are paying every month. I can assure you it's a disaster. Even sometimes when you sit, you are collecting people's money, try sometimes to inspect these hospitals. You will see. Just go at Chilenje Hospital. Of course, some hospitals you have heard that they are trying their best. But you are aware that right now, there are no medicines in the hospitals. That's a fact. And yet we are paying every month. Now when I'm sick, I go to UTH, I'll be attended to quite okay. Of course, I'll have to stand a long queue at UTH. It's crowded because at Kanyama, level 1 hospital, there's no medicine. Chaisa, there's no medicine. Chelston, there's no medicine. So now when I'm sick, I know I've got a scheme. I'll go to UTH. There, first of all, I'll spend the whole day there. And yet I'm a police holder of a medical scheme insurance. As if that is not enough, again, you find that you'll be treated to the doctors there. At the end of the day, you'll be given a prescription to go and buy. I heard the director say there are some pharmacies that you have accredited.
Correct.
But also in our demand, when this insurance scheme started, we wanted to see private hospitals being accredited so that I'm now given a choice to choose. Whether if I'm sick, because it's a scheme, and insurance doesn't choose, isn't it? Because you have the money at the end of the day. So we wanted, that is our demand in the beginning. We wanted hospitals like Hilltop Hospital, Fairview, Care for Business, Victoria Hospital, and many other hospitals to be accredited so that when I'm sick, I'm given a card. By the way, cards, have you started giving cards? The cards have not been given. They are not there. So now, even when you go to UTH or to any hospital, I have to introduce myself. No, I'm a civil servant. Look at that. Then we wanted the National Health Insurance Scheme, or Authority now, as it is called, to ensure that they put all these things in place so that it can be a choice for me to choose when I'm sick. Because many often, I don't go to public hospitals, for your information, and for simple reasons. I don't go there because if I go to UTH today, believe you me, there's totally nothing there at UTH. You find the X-ray is not working, the lab results are getting missing. I tell you the truth, I witnessed it myself. So those are the things that we want you to work on as NHIMA. Now, down here, the 1 year down the line, you've gotten a lot of money, and there's too much money, we believe. And you've talked about pharmacies. We are not told which pharmacies we can go to. I hope you are not referring to Honeybee Pharmacy here.
So, first of all, you are raising very cardinal points.
Yes.
And on set here, I would like to invite Comrade Mwale to come and visit his National Health Insurance Authority.
Yeah, at 11 Mwanawasa?
Yes.
Yeah, I know where you are.
I would like to invite you, you and me as
Formally.
leaders, to make sure that these matters are made available, and we create partnerships to send these messages to your member. Comrade Mwale, for the last 1 year, your DG has been going through hospitals.
Yes.
Your DG doesn't sleep in Lusaka. He comes, changes, he goes around the hospitals to make sure that your expectations are met. Today, I was going through all the hospitals in Lusaka to exactly have conversations on your behalf on these expectations. So, I have teams that are in Mwinilunga. There is a NHIMA officer at Mwinilunga District Hospital. I sent my director, he just came back to go to Western Province, to go and see how your resources are being translated into gradual improvements in healthcare services. Let's talk about medicines, Comrade Mwale. NHIMA doesn't cover our limitations. We have limitations. And as a national leader, you also know that nationally we have national limitations. But your NHIMA decided to say, look, whilst we are working on improving our public health systems, let us accredit private pharmacies. And I'm proud, Comrade Mwale, that some of the medicine headaches that we are facing in public hospitals, today you will be able to receive a prescription. Now, 2 years ago, I wouldn't be proud of talking about a prescription because it meant you pay from your pocket. Today, because of your support to NHIMA, you can go to any of our accredited pharmacies. You will receive medicine today as I speak, and you won't pay ngwe. Comrade Mwale, you spoke about private hospitals.
Yes.
As I speak to you, we have opened that window.
Thank you.
I have in my office a lot of applications. Your officers are just preparing their bags. They will be heading to the provinces to now go and assess these private hospitals. So that, number one, they provide the care you want. But also remember, this is money. There could be some people who have different ideas on how they can have access to your money. So your team in NHIMA must also go and make sure that they are the right people to work with. So we appreciate the challenges we are facing, Comrade Mwale. We appreciate that it has taken longer than you had wanted. But you see, whatever you say, DG writes and goes back to NHIMA to implement. So today, give us a week or two, you will start to see a lot of private hospitals. I'm excited. It means you will have a choice and an option in this scheme.
All right, let's take a break. This is a Crossfire with me, Gloria. We're discussing Zambia's health system with a particular focus on, of course, the health insurance. Let's take a break. The conversation continues on the other side. Keep watching. Welcome back. This is a Crossfire with me, Gloria, and of course we're discussing Zambia's health system with a particular focus, like I keep mentioning, on health insurance. We have in studio this evening Mr. James Kapesa, who happens to be NHIMA DG and also representing the voice of some of the members of NHIMA, is actually president of the Judiciary and Allied Workers Union of Zambia. That happens to be Mr. Mwale, Peter Mwale. Now, before we went on a break, of course, we had a number of issues that were raised. One of them was schemes. So how are people able to go to the clinic that was raised by Mr. Mwale? How are people able to go to a clinic and, of course, demand for these services if most of them don't have schemes to show that they're actually NHIMA contributors or members?
So, Gloria, what we did is that we noticed that the process of creating cards and distributing them will not happen in a day, because there are minimum requirements that we need to make sure that all your data is verified and then loaded, the card printed and distributed through the system. So what we decided to do is that we still needed to create an ICT platform that allows you, just using your NRC, to present yourself at a hospital. And then every hospital that is NHIMA has got a minimum of 1 or 2 NHIMA members waiting for you. When you get to the NHIMA desk, it's well branded. You present yourself, you present your NRC, and through the NRC, we'll be able to retrieve your records countrywide. And those records mean that then you immediately are given what we are calling a NHIMA fast track.
So is this already happening, or is
it's
this
happening.
A plan that NHIMA is going to
110,000 members, some of them from the Judicial Workers Union, have gone through this process, have accessed care. So when this happens now, we are then saying we needed to do this, Gloria, whilst we are working on distributing our cards. That's number one. Number two, Mr. Mwale also spoke around just the care itself. We acknowledge that there's a lot of work we need to do together as partners to improve the customer care that's happening in our facilities. We improve the general environment in our facilities. We talked about medication. We talked about what Mr. Mwale and his members, what the public, what Zambians are looking for is they get to a hospital, they are treated as quickly as possible. They are not looking for 5-star treatment. They are not looking for a DSTV in a room. No. They are looking for a clean environment. They are looking for a clean bed. They are looking for available medications. If they are asked to go to a laboratory for X-ray, they want to find an X-ray machine which is working.
Exactly.
These are the things we have put in an agreement between NHIMA on behalf of Mr. Mwale and his members with the Ministry of Health. Remember, in the law that was passed through the support of Mr. Mwale, NHIMA is a separate institution. So NHIMA signs an agreement, a contract, on his behalf, on your behalf, with the Ministry of Health, and say, we need the following minimum standards. Gloria, like all of us, when we start grade 1, we don't become proficient in English. But our teachers continue to check on us, and we do tests and exams. We have a full-fledged department that goes around hospitals again. Have the hospitals improved now? No. Can we start to see the germination of improved healthcare? Yes. Is it good enough? Not yet.
Which is what is frustrating most of your members, because I have with me some comments that we got from our social media. Not to cut you short.
Please go ahead.
There's one Benson Pandi Kalungu, and he says, here's my situation. I had an eye problem and quite all right, was diagnosed with a condition which required spectacles. I was well informed that I will get them free since I'm on NHIMA, but I have to wait for a month. So how can someone seriously in pain with eye condition wait for a month before receiving the spectacles? Can we say NHIMA is helping? One of the questions. Another instance that is given from Kenneth Kalila is on, he goes on to say, bluntly to say, the health system is broken in this country. We had the lady who needed a lung, that of course we saw the president come in to pledge assistance. She needed about 60,000 kwacha. Imagine an ordinary citizen requiring 60,000 kwacha to get, of course, help for that lung problem. How does NHIMA come in such an example? So we have all these examples and citizens that seemingly are getting frustrated because it's been over a year and you have been operating and they've been deducting from their salaries and their payments. And so where are we now? How fast can these systems begin to work for the people of Zambia?
Gloria, and speaking to the public who are watching us, these incidences where members of the public are unable to pay for their conditions is the very reason why Comrade Mwale and his team of national leaders decided to ask for a national scheme, not a specific scheme. These are the very reasons why NHIMA was established. I gave you an example of a retired civil servant who needed 80,000 kwacha for a heart process. NHIMA came through. In the case where there's a lady who needed a lung process, within the hospitals across the country, the first question they will ask you, whether you present yourself, is, are you registered for NHIMA? As I speak to you now, we are now ready as NHIMA to start door-to-door campaigns to register the informal sector. The informal sector has been coming to register on their own, but we think now the time has come for us to go and do a massive campaign to bring the informal sector on board, such that some of our sisters who have appeared on national television, on national news, could have been captured by the system, or could have simply gone to the hospital and said, I am NHIMA. If they are unable to contribute, government and NHIMA have agreed through the Ministry of Community Development to still bring them on board as the vulnerable. So the vulnerable are exempt from paying. And so this becomes one of the best programs government has ever done to actualize the way we lived as Africans, where if there was a funeral in the village, if there was a sickness in the village, those who had put the monies together. So Comrade Mwale may not go to the hospital today because he's well, but because the scheme is pulling money together, he is able through that scheme to support someone who is vulnerable, like one or two of our sisters who we saw being supported. But that is the very reason why NHIMA was established, to make sure that those people are captured and are treated, and NHIMA pays for that.
Before Mr. Mwale comes in, of course, there was one other aspect of the process taking too long. One gentleman had to wait for over a month to get to spectacles.
For spectacles, we again are saying that before NHIMA came on board, my colleague in that particular case will have had to, number one, buy the spectacles. He would have had to spend money. When NHIMA came into place, we signed an MOU with an institution called One Sight Zambia. One Sight Zambia has been working with the Ministry of Health, in selected hospitals to provide spectacles, and our people are paying. As we speak now, One Sight Zambia is working with NHIMA to provide spectacles, not for free per se, because Comrade Mwale is paying. So we are paying on behalf of him for the spectacles. What has happened is, because this program has been successful, One Sight Zambia, the demand through NHIMA has gone up 200%. So those delays are happening because we need to go back now and accommodate the increased number of our people that are now accessing spectacles through One Sight Zambia. So Gloria, it's bittersweet. Bittersweet in the sense that more and more of our people now have gotten spectacles. The demand has gone up. That's sweet for us. We then know that it's working. Of course, we now need to go back and say the demand of our people looking for spectacles has gone up. One Sight Zambia, Ministry of Health, NHIMA, how can we expand capacity? So the spectacles for my colleagues in that message, it's unfortunate he's waiting for 30 days, but we want to assure him that we are working day and night with One Sight Zambia. But we have also started receiving applications for eye hospitals. So soon and very soon, beyond One Sight Zambia, you will have eye hospitals accredited by NHIMA, where Comrade Mwale and his team can now go under a NHIMA card. So these things are working, Gloria, and the public can verify them. And like I said, I am receiving feedback from Comrade Mwale to go and continue improving. So that my dream as DG NHIMA is that each province should have enough private sector players who our judicial workers can go to. And hopefully, each district can have private sector players working together with government hospitals. Gloria, this is excitement. If we go to Vubwi or to Chadiza or to Sinda, if we go to Lundazi, and there's only Lundazi District Hospital. If I can have and encourage private hospitals in Lundazi, two things happen. If 2,000 police officers and teachers only went to Lundazi District Hospital, a private hospital will take some of them. Lundazi District Hospital is decongested. The local court workers and the magistrates have a choice. These are the things that NHIMA is putting in place. Some of them are already there, and we ask for forbearance and patience from our partners and support.
Patience is what DG is asking for from union and the members and the entire leadership. Really, one of my questions now is how that it's here. I know there was a lot of issues, like I keep mentioning, in the formation and whatnot, but it's here. NHIMA is here and people are contributing. You've mentioned some of the challenges, Mr. Mwale, that NHIMA your members actually facing in accessing proper healthcare services. Do you have solutions? What do we do to better that? Is this even attainable, what DG is saying? Of course, capturing everybody, universal healthcare, as NHIMA puts it.
Well, I think maybe the DG can answer that question, but in my view, what we are saying that, look, we are the ones actually who pushed for this medical insurance scheme as unions in our quest to improve the conditions of service for our members, right? Now, what I see as a way forward in this NHIMA thing, of course, us who have come in to support 100%, as the DG has said, we are 100% supportive of it because that started already. And I'm happy to hear on this program today that the DG himself says he needs more of our patience and our support. But also, as much as we are going to support, what we want is an assurance and guarantee from the DG NHIMA. Why do we need this guarantee and support? For simple reasons, Gloria, because first and foremost, we are paying for this thing, okay? Now, when you pay for a service, we expect efficiency. Of course, we know that it can't be done today or tomorrow, but you see, even in 1 year down the line, since we started paying, you go to the hospitals, the picture is not as the DG is putting it right now. That I can guarantee you. Because today, if I went to Chavuma, I would tell you the truth, some services are not there. And they are civil servants. Of course, I am happy to hear that the Director General of NHIMA is saying that he wants us to work with him, which we have done before. So what we want to see, Director, is very simple. Since we are paying now, and let me take even an opportunity of this program today to appeal to all my members, particularly those in the judiciary, that look, when we are paying, we deserve better. What we don't want to see, Director General, is that when I go to UTH, because I'm a policy holder of this insurance scheme, and I'm paying every month, I want to be treated like I'm the one. But what happens today, if I went, for example, even at UTH or any other hospital across the country, I'll queue with even those people that don't even pay to the scheme. The doctor will attend to me, he'll give me a prescription in the same way. Of course, yes, we've heard that there are some pharmacies who have been accredited, but also our worry is that even the medicines that we heard of expired medicines, those are our concerns. We know that, of course, NHIMA is different from Ministry of Health. But what we want to do is that, can we see a situation like my brother there? He goes with the eye problems, he's attended to, then he's told to wait for 30 days. Of course, the reason could be that maybe it's not the only one. There are so many. But what we need to do now is that, now that we are paying for this service, we want quality health services. We want quality and not expired medicines in public institutions. It is good that now there's a choice. And I don't understand, I don't know when when these private clinics are going to come. Because let's call a spade here. Believe you me, between private and public hospitals, better services are given from a private hospital. That I can tell you. That is my experience. I think even the DG will agree with me. I think even him, despite being NHIMA Director General or Minister of Health, many times you have gone to private clinics. That I can tell you. The reason is simple. But what we are saying, now that we are paying for this, can we see these hospitals, public hospitals especially, improve so that instead of us going to Victoria Hospital in Lusaka, we're able to go to UTH. Now, you go to UTH there, you find that one, the X-ray machine broke down. There are certain laboratory equipment, they are not working. Doctors, nurses, look, there's just that, you know. So we are not inspired at all. But what we are saying now, we want to demand, Director General, we are ready to help you, I can assure you. But can we see the improvement of healthcare provision in this country? Because otherwise, as one of them said, the healthcare system in Zambia has broken down. You see, it's not only me saying that. And this is a reality on the ground. Even now, if we leave this studio, let's go to UTH, you'll be shocked. I think even when did you go to UTH, Director General?
Yesterday, I was at UTH yesterday, trying to make sure that these issues you are raising are constantly under my
You go into these wards, there are no bed spaces. People are sleeping on the floor. Is that real? I mean, if I'm admitted at UTH, sure, I'll sleep on the floor. Is that what I'm paying for? No, Director General. we want to see that in hospitals, public hospitals especially, apart from people paying taxes, we are paying this insurance now. Why can't we have brand new beds in the hospitals? All pharmacies there, even stocked, so that once I'm seen by a doctor, I get a prescription, I go to the pharmacy within UTH, I'm given medicine. Right. That's what we want to see. And that's what it means when we say we want to improve health care provision. We feel very comfortable. But you go to UTH, there's no water. UTH is failing to pay water. Women in maternity ward have been there to see relatives. They are told to carry a bucket, what and what and what. I'm telling you the truth. Now, how can you have a public hospital, a UTH for that matter, offer such services when we are paying? Because, as he said, we are paying for those people that are unable to pay. I have no problem with that. But what we are saying, Director General, extend the resources, get even to those that bus drivers, marketeers there, unless they're vulnerable, and the act has provided.
Correct.
Who is vulnerable, okay? We have no problem. But those that, apart from the civil service, these others, let them pay. And when they pay, we want to see, when I walk into UTH, I should be able to say, yes, my man is working. But right now, in some words, E words, G words, people are sleeping on the floor. There are no beds. People are sleeping down there. Why, Director General? When we are paying, are we not supposed to be improving the health care services in this country to save the citizens of this country?
All right. I'm running out of time. So, DG, your reaction to that, and as you react to that, also just maybe how attainable, really, my question is, how attainable is universal health care?
Yes.
Comrade Mwale and NHIMA are on the same side, and this is the side of our people. I started by saying one of the painful realization that government arrived at is that only 4% of Zambians had access to insured health care. 4%. 96% were left their own devices. And so, I'm happy that Comrade Mwale is ready to continue supporting the scheme. Comrade Mwale is ready to walk with us. And NHIMA, from here, we will be talking to Comrade Mwale. There are many areas where we have commonalities on the scheme. And we want to broaden those areas of common and consensus. There are 2-3 areas where we still have different but valid views. I want to receive engagement from him. UTH is constantly under our interaction to make sure that where possible, the improvements that Comrade Mwale is speaking of. And if you went to UTH, I came to Lusaka many years ago. The UTH of then and the UTH of now. I know Comrade Mwale says he doesn't go to public hospitals. I will take you next week to UTH. The UTH of those years and now is different, not yet where it should be, but the UTH has made huge strides. That's not the point. The point is that we have an opportunity in our lifetime as leaders of this country to bring into birth a system that consistently finances health care systems. At the same time, empowers the general public like Comrade Mwale to watch over because they have a stake in it.
Exactly.
You see, Gloria, that's important because the 3 million to 5 million Zambians who are going to be making a contribution feel empowered that they are now making a contribution and that they will now act as watchdogs through NHIMA. As I speak to you, there is a toll-free complaints process, 8,000. And those of my comrades there who were writing, they can pick 8,000 and complain to NHIMA of services that they have not properly received. The guarantee to the public and those that are watching us today is that the journey of 1,000 miles doesn't start with the 900th step. It starts with the first step. The government boldly and courageously, Ministry of Health with leadership, decided that we are going to make this one first step. I can assure the Zambians that the 1 year we have been operating the scheme, the number of people that have profited and benefited from the scheme in 1 year, makes us feel fulfilled. This is the message of hope we want to share with key partners like Comrade Mwale. In the next 1 to 2 years, the face of healthcare service delivery in Zambia with the scheme will not be the same again. I only ask for more support from partners like Comrade Mwale. And I also ask them to be candid with the limitations we have so that they form us, so that they merge us. That's the only thing we ask for. But we have an opportunity to change the healthcare system for our people for the first time in many years.
All right. I wouldn't love to take those as your final remarks. So maybe just as we are still, the camera is still on you, your final remarks before we get to Mr. Mwale.
We want to announce to the nation that by the beginning of March, we will be rolling out a massive national campaign to register bus drivers, marketeers, peasant farmers, cross-border traders, fishermen, and all those who are doing welding in Kalingalinga. NHIMA has been preparing for the last so many months. So please be on standby. We want you to come on board. Number 2, we want you to take advantage of our complaints process for free to call NHIMA so that we can engage our partners like Comrade Mwale to resolve the issues. And we would also like to now invite every Zambian, wherever you are, to go to your nearest hospital and register. Gloria, as we sit now, NHIMA is present in all the 10 provinces. We have offices in all the 10 provincial capitals. And the idea is that if you are driving to Mansa, Kasama, Chipata, pass through a NHIMA office. The Act wants us to have offices in all the districts. So in 1 year, we are in all the 10 provinces.
Right.
Please register to become a member of NHIMA, register your wife, register your dependents and beneficiaries so that you are not left behind.
Is there a time period or time frame as to when we'll begin to see these services improve? Last question.
Gloria, if you go to UTH today, if you go to Kanyama, I was in Kanyama, I will be at Chipata Hospital tomorrow, first thing in the morning. And then I go to Matero. I had a team in Mwinilunga. If you go to Thompson Hospital in Luansham, if you go to Ron Antelope in Patamato, you will see that Comrade Mwale's money has started to paint wards, to create screenings, and he will find that the incidences of stockouts for medicine is not gone 100%. But because of his money, and I want to thank him and many Zambians who have entrusted their money in our hands, the progress has started.
Okay.
It may be slow, but we will be there one day.
All right. Your final remarks in less than a minute. I apologize.
Okay, yeah. So my final remarks are that, first of all, I would like to thank the Director General, Job well done, sir. You are assured of our support, but with the conditions, and our conditions are very simple. To all Zambians, especially those members that I represent, let us demand for better and improved healthcare system in Zambia. Why? Because we are paying for that. It's our money. We want to see medicines in hospitals. We want to see new beds and mattresses, blankets, bed sheets in hospitals. We want to see that whenever you go to the hospital, you are attended to 100%, especially for us who are paying. So basically, what we are saying, we don't want to hear a situation whereby you go to a hospital, you find rats in Ndola Central Hospital. That's not a very good situation.
Okay.
Because there's money now. And last but not the least, I want to appeal to the Director General that, look, I heard you said there's a difference between NHIMA and Minister of Health. Minister of Health, we don't trust the way they use public resources there. My appeal to you, sir, and I want to be on the record here today, the money that we contribute comes from hard-earned money, us as workers in Zambia. Account for that money and want to see the services of that money. We don't want to hear that the money that we contribute has been stolen through corruption like what happened at Ministry of Health. That we don't want to hear, and we will not allow that.
All right.
Because that's public resources.
Thank you very much. On that note, we come to the end of this week's edition of Crossfire. Thank you for watching, and of course, stay tuned to S24.